Hi, this is Sandy Kurtin. We're going to talk now about taking an active part in your care by tracking your progress. First, just a little review of some of the treatment strategies for MDS. Treatment is very individualized, and so among MDS patients there may be wide variations. Some of the things we take into consideration are what we call treatment triggers. These are things that tell us to initiate disease-modifying therapy. Some of those things include transfusion dependence, progressive or symptomatic cytopenias, increasing blasts, or high-risk disease. Once that decision has been made, then we individualize the treatment based on a number of things. That includes performance status, comorbidities, things like diabetes, hypertension, or lung disease, your IPSS risk category, and this will be covered in a number of other programs in the Building Blocks of Hope booklet. Then we say, is there primary or secondary MDS? Consider cytogenetic status, and then of course your lifestyle and your wishes. Once a decision to proceed with treatment has been made, there are a few key principles of therapy to keep in mind. The treatment of MDS takes time. We know it's not curable without an allogeneic stem cell transplant, and this is not an option for many patients. This is also covered in other parts of this program. It's important to know that not every patient who undergoes treatment will have a complete response. There still may be evidence of the disease. However, if there's hematological improvement, your counts get better, or your disease is stable, and you've become transfusion independent, those are good things. We continue treatment until the disease is no longer responding, otherwise known as disease progression, or if you're experiencing unacceptable toxicity. One component that makes us proceed with this strategy is something called methylation. It's a complicated process that has a lot to do with how MDS happens and why it may turn into leukemia. There are hypomethylating agents used to treat the disease, and we continue those knowing that without them the methylation will return. We also have a limited number of currently available treatment options so that we want to maximize each option we're using. Other principles include age. Many patients with MDS are over the age of 70. We know that age alone should not exclude active therapies. We consider many other things. Performance status and the presence of comorbidities are examples of those. It's important to know that your blood counts may actually get worse before they begin to improve with treatment, and that all active therapies for MDS require time to work. This may take as much as 4 to 6 months of continued treatment. That can sometimes be frightening or frustrating. So strategies for proactive management of side effects in the early phases of treatment are key to obtaining the best response. Let's talk a little bit about time and why things get worse before they get better. So we have to consider what is happening with the disease. Before treatment begins, blood counts drop because of the MDS and the abnormal bone marrow function. The bone marrow gets crowded, and the abnormal stem cells crowd out the normal stem cells, and your counts will be low. We then start treatment to treat the MDS and clear out the good and the bad cells, and your counts may look a little worse as it looks on this slide. As the patient begins to respond to treatment, we start to see some improvement then in those blood counts. Again, this may take several weeks or a few months. And then as that response continues, we begin to see normalization of the blood counts and improvement overall. And you may no longer require blood transfusions. The tricky part is getting through those early parts of the disease when it appears to be that you're experiencing toxicities. I like to think of these as expected cytopenias, and we'll talk a little bit more about that in a moment. So in order to get through what I call the ravine, the early drop in counts, we need to work together so that you can go on to have a good response to therapy. So keeping in mind that time is required for the best response, usually a minimum of 4 to 6 months, that cytopenias or low blood counts often get worse before they get better, and we have a number of strategies to get through those initial cycles of care. There are dose modifications, so changing the doses, taking breaks in treatment or treatment delays. There are many supportive care options. All of these are being covered in the Building Blocks of Hope program. Things like blood transfusions, growth factors, and antibiotics. And then really just setting the expectations, knowing that things may get worse before they get better, and when the counts recover, they may not be completely normal, and that's okay. There may still be evidence of the MDS. That doesn't necessarily mean that you won't feel well and be transfusion independent and not require more intensive care. This is an example of a patient graph. This is a patient that I have followed for many years who has MDS, and it shows how this patient has tracked his treatment over time. And there have been a number of fluctuations in his blood counts. The pink line is the hemoglobin. The orange line is the platelet count, and the blue line are the WBCs. You can look to the left of the graph and see that many of those counts dropped very quickly when he started treatment. So they got worse, and then they got better. They started to go up, and in particular, his hemoglobin has improved, and he has been transfusion independent for more than 12 years. It's also important to keep in mind that in the early parts of treatment, you need to be monitored a little bit more closely. So as those counts drop in the early phase of treatment, we're going to want to check your blood more often. So this is one way to track your progress. Not all of you may be capable of creating this kind of graph. So we have a number of tools available to you in the Building Blocks of Hope program to help you build your own MDS plan. There are tools such as this to help you create your health profile. This is just general information that's handy to have all in one place so that you can share this with your providers when asked. There is a tool to map out the initial diagnosis of MDS. This is important because we calculate your IPSS score, we talk about the subtype of MDS, we may look specifically at the chromosome profile or cytogenetics. This is a way to have all that information organized so that you can share it with a variety of providers and have it for yourself. We then want to know how you do over time, and so this would be where you would calculate the information or track your progress similar to the graph that we just viewed, by dating and noting your hemoglobin, your white blood cells, your absolute neutrophil count, or ANC, the platelet count, your ferritin or other pertinent labs, the transfusions, and any notes you might have about those dates or values. The next thing that's really important to keep in mind is communication between providers. So there's a tool for you to enter in who referred you to the MDS center, and who your primary care physician is so that those people can collaborate and better take care of you. There are a number of other providers that might be involved in your care, and you can list them here. Insurance information is important, so this allows you to put all that in one place so that you are not needing to always look for the card. It's a way of organizing your information. All of these tools will help you plan and take part and be organized in managing your care.